Dr. T.J. Trad is 16 years educated at Oklahoma State University. He did his undergraduate here in Stillwater at Oklahoma State. He did a master's in science over at the College of Osteopathic Medicine, and then got his doctor of osteopathic medicine and internal medicine over there. And then he did some training in cardiovascular fellowship at a hospital affiliated with Harvard. So with that, he's going to talk about hypertension and all the things that you need to know about high blood pressure. So with that, welcome Dr. Trad. Thank you very much for being here.
I tend to move a lot, but they told me to just stand here right in front of the camera. So it's going to be a little difficult for me.
Louder, please.
All right.
Thank you.
You hear it better now?
Yeah.
Okay, so that's another reason why I should just stay here. All right. So hypertension is a very important entity, and that's why I really wanted to talk to you guys about it. It is, in the United States, the second most common cause of heart failure, the first cause of strokes, the second most common cause of kidney failure. So you can obviously tell, how important it is. Now, the issue with it, a lot of people don't even feel it. So that's why I mentioned the silent killer, is because by the time it appears, it is sometimes, a lot of times, it's too late. So it is very important for us to be aware of that, especially with the age group presented today. So you're going to notice that there are different guidelines that we go by. In the United States, guidelines differ with elderly above the age of 65 when compared to people that are below the age of 65. So therefore, as we get older, we are more lenient actually on what we call hypertension. And the reason why is because in the elderly, having low blood pressure is very detrimental to your function. And almost always is related to people passing out. So therefore, we are more lenient. We use less medication and sometimes different medications depending on what kind of comorbidities you have. What that means that if you have high blood pressure along with heart failure or kidney failure, that can dictate on what kind of medicine we use. So the definition in general is that normal is less than 120, but if you are above the age of 65, it is less than 140, okay? So we start treatment once we get to stage 1 or 2, okay? So the normal and pre-hypertension is basically when we start looking at what we call lifestyle modifications. What that means is, number one, we need to control our salt intake. There is lots of studies that show that a low sodium diet is actually really good for you. The American College of Cardiology, the only diet that it recommends is the Mediterranean diet. So if you want to Google or research, what kind of diet you should eat, the only one that is recommended is the Mediterranean diet. So none of the others that you see in magazines or on TV, none of them have been actually studied except that one. And repeatedly, over the last about 12 years, research has been shown that Mediterranean diet is the best diet. So if you want to adopt one, that should be it. In terms of other lifestyle modifications, sleep apnea. We know that a lot of us can snore, or if you don't know whether you snore or not, just ask your partner. And if you don't have your partner, maybe ask your neighbor if you snore really hard. But it is very important for us to control sleep apnea, because sleep apnea is directly related to irregular rhythms, directly related to heart failure, directly related to strokes, and obviously to uncontrolled hypertension. So if you do snore, please talk to your primary care doctor, and then they'll do a sleep study on you. So that's another risk, lifestyle modification. Now, a third one will be walking. Moderate exercise is incredibly important. And what that means by moderate is speed walking. You don't have to run, you don't have to go up the stairs a lot, but you definitely can speed walk. You can speed walk around your neighborhood, speed walk around the lake, 30 minutes to 1 hour every day, no days off. And that's what I tell every patient. 30 minutes to 1 hour every day, no days off. So it's important for people that have pain in their legs. It's important for people that have some sort of coronary artery disease, because this is the way we build collaterals. It's kind of God's way to give us spare tires in the heart, in the brain, and in our legs. So the more you walk, the better. I wanted to put this here because of also the audience that I'm talking to. There were a lot of studies over the last 7 years that looked at the direct relationship between hypertension and dementia, and hypertension and Alzheimer's. And it is directly related. So it is important that we do check our blood pressure on a regular basis. And what that means is you're checking your blood pressure once every night before you go to bed. So it's kind of like brushing your teeth. You check your blood pressure, you write it down. It helps everybody involved in your care. It helps your primary care doctor. If you have a cardiologist, it helps the cardiologist. So a very good habit to acquire will be checking your blood pressure at night before you go to bed, because it kind of takes into account your whole entire day worth of activity. Okay, so some people say, you know, what is the best time? Yeah, just before you go to bed. Make it a habit, and it will become part of your daily life. So highly recommend for you to do that, because if you catch it early and you start treating hypertension at an early age, you can easily prevent dementia. You can prevent at least one of the major factors for dementia and Alzheimer's as well. Also, as we discussed earlier, that depending on what comorbid conditions you have, so what that means is, do you have kidney failure? Do you have an irregular heart rate? Do you have diabetes? When you talk to your primary care doctor, make sure that the blood pressure medicine that you're on is related not only just to hypertension as an entity itself, but is it also helping whatever else you have? So that is why it's important sometimes to just see a cardiologist, even for one visit a year, to kind of go over the medications and just like basically give you a sound advice. Because just putting somebody on a blood pressure medicine just randomly is not a good idea. These are the guidelines that we actually go by, and this is what I was talking to you earlier, that above the age of 60, you know, recently they looked at 65, that's why I mentioned the word 65, but looking at how the difference between elderly and younger people, it is drastic when you look at the blood pressure goal. And in fact, the most recent study showed that if you're below the age of 60, you have to be less than 130, not only 140. This is as recent as last year, but within the last 6 months that have changed. They changed it based on what we call consensus statement. But if you want to take a message from today, your blood pressure, the top number, has to be less than 140, okay? So that's the top number. And the bottom number has to be less than 90, okay, for your age group. So it is also important that if you do have high blood pressure, that you ask your primary care doctor to do a lipid panel, a cholesterol panel. Because a cholesterol panel would allow him to calculate your 10-year risk of stroke and 10-year risk of heart attack. And you can ask him, hey, what is my risk for a stroke? And we will be able to adequately tell you what, in terms of percentage. Okay, now, on medical therapy, so let's say you come in and your cholesterol is high and your blood pressure is mildly uncontrolled, and we do this calculator, and the calculator said that it is 10%, which is pretty high, because the normal risk for someone your age should be less than 3.1%. So if I say, oh, it's 10%, then how we can augment that is by putting you on medications, okay, putting you on cholesterol medicine. Even sometimes, if your cholesterol is normal. I don't want to repeat that. Being on a cholesterol medicine, on a statin, sometimes it's important, even if your cholesterol is normal. Okay. So as we said, the risks for hypertension is heart attack, stroke, heart failure, renal failure, and death. And so the silent killer, it is very highlighted, because you'll see people with time. What happens is that, let's say your blood pressure is in the 160s, 170s, you get so used to it that the only time you get symptoms is when it's like in the 200s, and that's like incredibly high. I've seen it over and over and over again. And the reason why that's the case with elderly is because our arteries kind of gets hardened with time. Okay, they're not as malleable. They're not as fluid as before. So, and there are a lot of medications that we use that would help these arteries to be less stiffened, and therefore, you know, it is important to talk to the cardiologist at least once in a year if you do have hypertension. So we already talked about that. Good sleep habits, what does that mean? So also there are a lot of studies that related direct relationship between sleep habits and hypertension. People that sleep during the day and work at night, that's problematic. Usually they do have hypertension because vitamin D deficiency, okay? Vitamin D deficiency that we take from the sun is directly related to hypertension. So if you fix your vitamin D deficiency, that would help augment about 5 millimeter mercury your blood pressure. Okay, so that goes diet, lifestyle, you know, getting at least 6 hours of sleep every night, that's important. Usually the average between 6 hours to 8 hours of sleep is what we recommend. And that is it. I wanted to make it short, I wanted to make it very informative, and this way everybody would not feel overwhelmed. And if you have any questions.
All right, so we do have time for questions. Do you have the mic back there? I'm sorry, I wasn't ready.
I have read and understood that blood
Hold
pressure.
on 1 second, I'm sorry. Let me come to you so everybody can hear, and we have a question in the back, I think, too, so get over there. Thank you.
I have read and understood that blood pressure is normally higher in the morning than at night. So what does it mean if it's reversed?
If it's higher at night than in the morning? I mean, it could be directly related to deconditioning. So that's why I said it's important for us to take it at night, because it allows us to take into account your overall daily activity. Okay, so how your body responds to movement, to activity throughout the day. So people that do have what we call stress-induced hypertension, there are hypertensive people. Okay, so that's why we say check your blood pressure before you go to bed. So an indication for a high blood pressure at night means that you are deconditioned, that you need to do the 30 minutes to 1 hour of exercise a day.
Okay, we have another one here.
Actually, what you just said is related to my question. What is it every day?
Every day, no days off. Yes.
An hour of walking is
30 minutes to 1 hour of moderate exercise.
Can
Equal.
it be like 15 minutes and then later 15 minutes and then later 15 minutes? It has to be 1 hour at a time.
Mhm.
Okay.
And the reason why is because you want to have that, what we call the crescendo. Okay, so you don't have to have your heart rate, let's say, elevated all the time, but it helps to get you, the more demand that you give your body, the more you recruit more vasculature.
So you're saying by walking you don't mean struggling?
I mean, just you try to push yourself.
Okay. All right, thank you.
All right, I think we have another question here. Oh, okay, all right.
Do you recommend taking a baby aspirin every day? I've heard that's wisdom as a
That's-
blood thinner.
That's a good question. No. So unless you have hypertension along with coronary artery disease or other what we call coronary artery disease equivalent, which means that you have diabetes or any other, let's say you're a smoker, you have some family history, etc., then maybe yes, you talk to your doctor about it. But as a general rule, no.
I'd like to sneak in too if I could. A long time ago, because of a job I had, a physician said I should take blood pressure medicine. It's just continued. Every physician since then has said, keep doing it. Do you advocate that?
So that is why it is important for us to do what I just mentioned. It's called an ambulatory blood pressure monitor, which means that checking your blood pressure at night, okay, and keep a log. And because that benefits the primary care doctor, benefits the cardiologist. So let's say you come in to me and you're showing me that a trend, because we don't want to give you blood pressure medicine based on one reading, and that's the common misconception. It's because you show up to the doctor, you get a blood pressure reading, and let's say it's 160. But what if at home, over a period of 2 weeks, it has been 110? So let's say the doctor would look at it and he'd be like, oh, it's 160, I'm gonna give you a medicine. You go home and you just collapse. So that's why it is very important for us to have a trend, you know, to have a systematic way to deal with a problem like this. So to answer your question, is that check your blood pressure on a daily basis for about a month. Bring your blood pressure up to the doctor, and if he feels or she feels that your blood pressure is low, then they might stop or take one of your medicines out.
Then the second follow-up, then I'll be done. I ride my bike every day for 55 minutes.
Excellent.
Well, up and down hills, pretty vigorous. In other words, I sort of look for hills. Can you overdo that?
No, you can't overdo it.
When is the best time to take your blood pressure medicine? Is it morning or night?
At night before you go to bed.
Thank you.
At night?
Yes.
Why?
Yeah, as we mentioned a little earlier, it takes into consideration your overall daily activity. So the stress on your body.
My question is, your office insists that I take my blood pressure medicine, my blood pressure every night. I just cannot. It goes up. I mean, I have that syndrome, and it goes way back to Dr. Ernest, who told me never to take my own blood pressure, never go to Walmart or any other place, and never can do it. And
Okay.
this time when you had the ambulatory thing that I was wearing for a month.
Okay.
And how do I cope with this? Because it scares me so much, I think I'm going to have a heart attack.
Okay.
You
So,
look very relaxed right now. Yeah, you look very relaxed.
so let me,
Just, you look very calm and relaxed.
all right. So I always tell my patients that have very labile blood pressure. What that means is like it goes up and down, it's never necessarily, you know, consistent, is to bring their blood pressure cuff to the clinic, and we can compare it to a manual reading. So therefore, we can check the accuracy of whatever you have at home. That is very important, because if, let's say, the machine that you have at home is giving you erratic readings, then you're going to be holding the meds and then taking the meds again, and it's a mess. So, so that's why what I do with my patients is I see them very frequently at the beginning, so once every month, once every 2 months, until I level them out, and then I release them, and I see them once every 6 months.
Okay, we have a question here, and then I'll come back over to that side.
That many people take aspirin to thin their blood and this type of thing, and have for years, but most cardiologists today, as I understand, have you taken and changed it to Eliquis instead of aspirin. And
That's incorrect. Eliquis is only...
Did you say that's incorrect?
Incorrect.
Okay.
Yeah, Eliquis or any other type of anticoagulants, they're different. They're only used for people that have atrial fibrillation or an arrhythmia.
I'm coming around, I got one on this side, and I'll come back in the middle. I'm doing my best build on you, ladies and gentlemen. Here we go.
Speaking of trending, can you talk more about diastolic and blood pressure and why it might be trending up?
Okay, perfect. So diastolic blood pressure is directly related to the volume in your body. Okay? So if you notice that the lower number is high, that means that your diet is high in salt. Okay, so that means that you need a diuretic. So a systolic blood pressure, the reason why we always kind of like target the systolic much more than the diastolic is because it is the one that is most studied, and it is the one that is most related to all the risk factors I mentioned. But yes, so when you notice that the lower number is high, that means that you're not taking care of your diet.
I thought that was your pager for a minute.
Okay. You mentioned the cuff. Is that your preferred method of taking blood pressure, or is there a particular blood pressure machine or whatever that most
That I
cardiologists
recommend?
recommend?
I don't recommend the wrist one. I recommend the one that goes all the way to your arm, you know, and closer to the heart, and it's more accurate.
Thank you.
Good to know.
Your talk was fabulous, and I love your slides.
Is there a way we could have access to those to
Yes.
show our
Yeah,
spouse?
I'll give it to.
Yeah, we'll make sure that we put those with the video and, or we'll put them on our website so you'll have them there. Okay?
I would like to have the initials explained, because you have a lot of things like CHV or something, and I don't know what it means.
Okay. Yes, this talk is basically just diluted, just so that I can just talk, faster. But yeah, like CV means cardiovascular, DM means diabetes mellitus. This is like terms we use, but we can easily change that.
Yes, you indicated earlier that everybody probably should take a statin, even if you do not have high blood pressure. Is that, or high cholesterol, I mean, is that true?
Yes, so what that means that if I check if you have hypertension, okay, and let's say I check the calculator, which is the ASCVD 10 years, so we do a lipid panel, and I'll check it, and you fall within a certain number that is mildly high, then I will put you on a statin. And the reason why is this. So let's say your cholesterol is borderline, okay? But your hypertension or your blood pressure is uncontrolled. That puts you at a high risk of stroke and a heart attack. What the statin does, so you're not at that point using it for cholesterol, you're using it to stabilize plaque, okay? In every person that have a heart attack or a stroke, you would think that the reason why they have a heart attack or stroke is because of blockage that is 80%. That's not true. They have a heart attack or stroke because of a very, I would say, unstable 20 to 40% blockage. A blockage that doesn't cause symptoms originally. So that's why it's important to have a statin, because what the statin does, it comes and stabilizes that plaque, stabilizes the cap of the plaque, and prevents you from having a heart attack or a stroke. This is a very important concept that sometimes even doctors don't understand.
Okay, what strength would you recommend for?
Good question. That's depending on your ASCVD risk score. So let's say if once you get the blood level of the cholesterol, then we'll be able to say you should be on an intermediate intensity statin, high intensity statin, etc. So the recommendation is based on objective findings.
Yeah, I think you mentioned earlier that it's best to take your blood pressure medicine at night.
Not medicine, blood pressure.
I mean, your blood pressure, but what, I'm taking your blood pressure medicine, your medication. If I'm on two different ones, should those be taken at the same time?
No.
One in the morning and one at night?
So depending, so for example, like let's say if the medicine is a close to 24-hour medicine, you just take it in the morning. If the medicine you're taking twice a day, you just take it twice a day. The only medicine that is usually taken at night is the statin.
My blood pressure is consistently running 170 to 190. I'm on all kinds of medication, and I'm having trouble breathing.
Yeah.
My doctor's out of town. Do I still need to go in?
Yes.
One more over here. Yes, sir.
The blood pressure medicine is in the morning.
As I said, so some medications you take twice a day, so you just take it twice a day, and some medications you take in the morning because they act all day long.
And what do you consider the high on LDL?
The high on LDL?
High on LDL.
Okay, anything above 150.
Why are you going down to 66?
That's because most likely you have diabetes or a history of coronary disease. Are you diabetic?
No, I had a heart attack and never knew it years ago.
Yeah, so that's coronary disease. So that's why you have to be less than 100.
So, is 66 good?
Yes, very good.
I was 77, and then he said, we're going to up you, and I won't say how many mgs of Lipitor I'm taking.
Well, less than
It
100.
was checked 66, I think.
That's really good. That's really good.
Good. All right, here's another question.
Okay, I'm highly allergic to statins, taking a pill.
Okay?
What's the alternative if you need that type of, if you're having problems and you can't take a statin, then what do you go to?
Yeah, so the second line will be a medicine called Zetia. Okay? And if you are also, if you can't take Zetia, there's a biological shot that you take every 2 weeks called Repatha.
All right, great questions. Got my heart rate up. This is
Yeah,
good.
you guys have-
Good stuff. I know
you
not
guys
to
have
count doc, because it hadn't been consistent.
They are very thorough. It's excellent.
That's good, yes. Yes, I do. I take my blood pressure. Actually, I'm taking it every night and every morning right now for a variety of reasons. And it's not because I've ever been president of the university or senator. Anybody have another question for the good doctor? Of course. This is just to get my heart rate even higher, isn't it? Oh, yes, good.
Thank you very much. There's a disagreement between the two people seated here. So would you just be kind enough to repeat, you take your blood pressure at night?
Correct.
Do you take your blood pressure medicine at night?
No, you just take it in the morning unless the medicine is twice a day.
You misunderstood.
Thank you very much. That was an excellent answer on your part.
And you can tell they've been married a long time because they're still sitting next to each other after that. So, all right, other questions? Great questions. Yes, sir. Let me go over here.
I would like the doctor to repeat the answer he gave the lady about could not take statins.
Oh, could you repeat the question? Okay.
Yes, so if she can't take statin, if she's allergic to statins, then she can take a medicine called Zetia. If Zetia is also causing allergies or side effects, then there's a third option. It's a shot that you take every 2 weeks called Repatha.
Great, succinct questions and succinct answers. You gotta love that, right? Cut to the chase. Okay, yes, we have one more question right up here.
What if you walk with a cane or something, you cannot walk fast?
Very good, very
Then
good
you
question.
do sedentary aerobic exercise, so upper body, lower body, while you're sitting. And you do it for the same duration.
Okay.
Very good. Other questions?
Okay.
Wow, you've answered them all. Fantastic. All right, well, let's give Dr. Trad a hand and thank you